So now I would like to move on to talking about the PozQol tool, and in doing that, introduce Timothy, Krulic and Petrina Hilton. Timothy is a health promotion officer at Positive Living Victoria, and Petrina is here with us from Archers at the Trobe Uni. So thank you so much for joining us, and look forward to hearing about the PozQol tool.
Great. Hi. Thank you, Isabel. I'm just going to get the slides started. Okay, that's Living Positive Victoria's logo. Great, and yeah, thank you for the introduction, Isabel. Yes, my name's Timothy. I'm from Living Positive Victoria, and yeah, and I'm a health promotion officer from Living Positive Victoria. And today, my colleague Petrina, from Trobe University, and I will be talking to you about PozQol, which is a scale that has been developed in Australia to help better value and understand quality of life for people living with HIV. And before I pass on to Petrina to talk about the scale itself and how to use it, I wanted to give a bit of a background on the concept of quality of life and how it relates to living with HIV. So I know that these concepts probably won't be all that new to many of the people in this audience, and so we can think of this as a bit of a way of rehearsing some of these arguments and having a bit of a public health promotion and social justice rant together. But essentially quality of life is a broad-ranging concept of health and well-being, which encompasses an individual's perception of their place in life and within the context of their culture, values, goals and expectations. So while good physical health will certainly make up part of what makes a good quality of life for somebody, a good quality of life will also depend on things like an individual's psychological state, their relationships, their community, and the opportunities available to them in life. So in a similar way, what this means for people living with HIV is often very similar to what makes quality of life for a lot of people. But the way I kind of think about this is in a similar way to while treatment, might be is crucial for preventing disease for people living with HIV. Viral suppression alone doesn't ensure a good quality of life. And globally, we know that people living with HIV experience high rates of non-communicable diseases, depression, anxiety, financial stress, and stigma and discrimination, all of which affect quality of life. And we also know that factors related to quality of life, such as poor mental health, stigma and discrimination, have a negative impact on treatment adherence. So in this way, we can kind of think of improving quality of life for people living with HIV as part of a commitment to health equity and social justice. But as those are key principles of health promotion, we can also think of improving quality of life as a way of helping end HIV. And it's for these reasons that since 2016, there have been calls to include good health-related quality of life as one of the fourth 90s to UNAIDS treatment goals. Okay, so what do we know about the quality of life of people living with HIV in Australia? Well, according to a long-running national study, HIV Futures, most people have long reported an overall good health and well-being, and this score has always been based on responses to one general question, which asks participants to describe their overall sense of well-being, including physical, emotional, and mental well-being. And Futures 9, which was the last time that Futures ran in 2018, was also the first time that the PozQol scale was used to help, deepen our understanding of what that score entails. And this showed that 63% of people living with HIV reported experiencing a good quality of life. So while PozQol is a more nuanced measure, this overall score can still mask some of the diversity. And the survey also showed considerable prevalence of depression, anxiety, non-communicable diseases, and the impact of social isolation, stigma, and discrimination. And then there was also divergence over different variables, particularly age. And so our national goal in Australia now is to raise the proportion of people reporting a good quality of life to 75%. And the rest of this presentation will hopefully deepen our understanding of what the PozQol scale is, how people working in primary healthcare can use it to better understand the quality of life challenges that people living with HIV experience, and some of the things that we can do to address them. I'd like to pass on to Petrina now, who can elaborate a little bit more on what the scale itself is.
Yeah, hi there. Thank you, Tim. Hi, everyone. I'd just like to really quickly begin by acknowledging the traditional owners of the country that I'm on, and I think we're probably all in different spaces around the place, but I'm speaking to you from my home in the Djaji country. So I'd like to recognise those traditional owners and their continuing connection to land and waters and culture, and that sovereignty was never ceded, and to pay my respect to their elders, past, present and emerging, and also to any Aboriginal or Torres Strait Islander people who watch or listen to this presentation. And in a similar vein, and in the context of the work that Tim and I are talking about, I also want to acknowledge the contribution, the really, really important contribution of people who are living with HIV. The fight against HIV and AIDS relies really heavily upon people living with HIV putting themselves forward as subjects and participants in research. And our fight against HIV is heavily indebted to them. So firstly, I just want to give you a little bit of background about the PozQol scale and the PozQol project. It began because HIV organisations across Australia expressed a need for a short, practical and reliable way to measure their clients' quality of life. The project was built on the principles of the greater involvement of people living with HIV. So what this meant in practice was the study was a direct partnership with peer-led organisations who represent people living with HIV. People living with HIV had meaningful involvement in the conceptualisation and prioritisation of the domains of wellbeing that the scale covers, also in the development of the items, the decisions concerning the refinement of the scale, and their insights and those from other stakeholders supported the balancing of statistical rigour, conceptual accuracy, and practical use. The project happened across 3 stages. The first was a systematic review of the literature and currently existing scales, and from this, 4 domains of wellbeing were identified and a draft scale was generated. The second stage involved the draft scale being tested, firstly with a panel of 13 experts from people living with HIV peer organisations, as well as 5 other HIV experts and stakeholders. And then secondly, via a survey that was completed by 465 people living with HIV in Australia. I think the slide has a typo in it, but it was 465 people, adult people living with HIV in Australia. This survey that they completed also included items from validated scales, and so their responses to the draft PozQol items were cross-examined with their responses to the validated scale items, which was able to show that the PozQol items were actually measuring what we thought that they were measuring. And also the participants completed the same survey a month later, and this ensured that the results were reliable and, not just sort of based on how they felt that day. So all of that to say that the scale can be trusted, and it has absolutely been developed with input from people living with HIV. And so we know that it measures, the things that are important to them, which is really important. And the third stage of PozQol was a pilot across 12 community and clinical settings to assess if it could detect changes in quality of life over time, which was a sensitivity arm of it. And also the usability arm was to see how easy it was for staff to use PozQol in their day-to-day work and whether they thought it was useful. Okay, so all of the results of the first two stages was the PozQol scale that we now use. It's a 13-item scale that covers 4 domains of wellbeing. These are a psychological domain, which includes mood, coping, and hope for or fear of the future, and self-worth. The social domain is about personal and social life, so things like belonging, support, and also covering social stigma. The health concerns domain is not about people's physical health or how healthy they are, but actually about how they feel about their health. So it includes things like health-related worries and how easy it is for them to manage HIV and their treatment. And the functional domain is about whether a person feels that they can live what they would call, a normal life. And this includes things like independence, meaningful occupation, and a good standard of living. Each of the items in the scale is a statement about how a person living with HIV feels with respect to some aspect of the domain that item is measuring. The respondents are asked to indicate how strongly they agree or disagree with each statement. And then on the basis of their responses, you can see how well they are tracking overall as well as within each domain. So the idea is if you administer PozQol at an early appointment or before starting a workshop or a program, you can see how someone is doing at that point. And then if you re-administer it after the workshops or after the program or on an ongoing basis every 3 to 6 months, you can then see how they're tracking overall and within each of the domains. So moving on to stage 3, which was the sensitivity and usability trial. Firstly, PozQol was sensitive enough to detect changes in quality of life over time. This was true for the PozQol scores, as well as for the overall. This was true for PozQol scores for overall quality of life, as well as for each domain of wellbeing. And also, this was true when there were relatively small sample sizes. So it is a very sensitive scale from what these results show. And secondly, regarding usability, overall, most staff who used it found that it was easy to use in their day-to-day work. This included staff from across a variety of service models, including hospital and high caseload general practice clinics. And the staff that used it said that it was easy to use, it helped them better understand the client groups they worked with, it enhanced their communication with their clients, and it raised topics for important conversations that may not have happened otherwise. I think it's important for transparency to say that some staff did have challenges integrating PozQol into their day-to-day practice, and this was especially true for people in clinical settings. These challenges were mostly logistic, and I think they would be challenges you would find trying to implement any sort of new process anyway. And they included needing to set up new data collection and storage processes, running out of time during appointments to talk to clients about results, and not having a quick and easy way to calculate and use the scores, which we've actually tried to sort of fix with some of the things we've done in the interim period between then and now. So hopefully those ones aren't quite the issues that they were previously. And despite the challenges, there are some really compelling reasons to try and overcome them. Of course, focusing on quality of life is a really enormous part of achieving quality care and maintaining positive health outcomes. Clinicians who used PozQol in their practice, despite the challenges, reported a whole heap of benefits, including, and this is a direct quote from Dr. Jenny Hoy from the Alfred, saying that it helped them bring patient-centered care to the forefront of their practice and consider the outcomes of utmost importance to the people living with HIV. And I think that's really key. Other comments were that it revealed information they didn't previously know about patients or clients. It helps them identify patients who are not managing as well as they had thought they were. It opened up discussions about referrals to community support services, quantified information that they already knew but hadn't been able to track before, and allowed them to measure and track information over time about quality of life. Since the project's finished, there have been a few little developments. Firstly, we have built a website. The website has a lot of information and resources, including versions of the scale in 16 languages, which is great, particularly I think in Melbourne, where we've got lots and lots of multicultural people. It's got score calculators. It's got different tools on Excel where you can change the language and put it all in sort of on the fly. So some of those logistical challenges we've tried to address with these tools that we've created. And there's a Using PozQol in Clinical Services section that was created with input from clinicians who have been using PozQol in their practice. So hopefully it's got some information that'll make make that a little bit easier and more streamlined. I think it's also important to point out that PozQol is now being used all over Australia by most Australian people living with HIV peer programs. It's being used in an increasing number of community support programs and some clinical services, as well as in research studies. And it is the indicator that is used to inform the Australian National HIV Strategy about quality of life among people living with HIV. So all of this, I guess, means that there's a pretty high likelihood that if you have patients or clients living with HIV, they will have come across PozQol already, and someone might one day present to a consultation with the results of a PozQol survey asking for support. And it'd be really great if clinicians would, know what to do with that and how to support them. And I think that's a good spot to pass back over to Tim.
Thanks, Petrina. Because I think we wanted to include this slide as a bit of a conclusion and as a bit of a way to help give everyone a bit like an idea of what you can do once you kind of learn a little bit more about the quality of life challenges that your clients may be experiencing. It might not have been something that has previously come up with clients, or it might just be a way to start the conversation about how you can, about different services and resources really that are out there and available to help people living with HIV. And I realised I didn't give too much of a background on what kind of organisation Living Positive Victoria is and the services that we provide earlier. Living Positive Victoria is a peer-led organisation for people living with HIV. All of our programs are either all of our programs involve people living with HIV in the development and delivery of them, and it's often the first place where people living with HIV meet another person living with HIV, which can be a really empowering environment and a great way to kind of address some of those social wellbeing concerns and generally just help normalize HIV. So, we provide a range of peer and community support services that are targeted, and we aim to really provide to cater for all people living with HIV. So one example here, I guess, is our members of our Taking Charge group, which is a social group for people aged 50 and over. And that group provides, a way to kind of meet people and socialize and get some of that social connection, but also has like kind of monthly topics about health issues. And it's linked to a chronic self-management course that we run in partnership with Thorn Harbour Health that gives a lot of skills to help with managing the different complexities really that can kind of happen with aging with HIV and all the different comorbidities and issues that can kind of start to really impact on quality of life. So I thought it was a really good example. And I guess it's also a kind of example that people don't often I think as a sector, we're very well aware that when someone's newly diagnosed or a new diagnosis, there's lots of need to help address the kind of psychological impact or the kind of coping for a new diagnosis. So it's just an example of the kind of breadth of the kind of quality of life challenges. And in our futures as well, I think it was the 50 to 60 around that age cohort which had the most challenges for quality of life and those comorbidities. So we're really expecting to see improvement in a lot of the measures in the scale, in the PozQol scale, around social wellbeing, the impact of stigma, and how easily people manage living with HIV and treatment and their other health concerns. And we actually use the PozQol scale in our programs to measure this change. I played quite a bit of a role in helping administer PozQol and integrate it into our evaluation systems across our programs. And I can say that, yeah, like even for an organization like ours, which, community orgs do struggle as well with, the same challenges of being busy and integrating new data collection processes and things like that aren't really easy for us. So it's been something that we've been able to do. I think a lot of the tools on the website that exist now to really quickly calculate and understand what the scores mean have been really, really helpful. So just from my perspective and from the perspective of a lot of staff, it's been really useful. We used to have other measures, and PozQol is short and, very sensitive. So we're able to incorporate it into evaluation when people enter programs and then repeat over a 3 to 6 month period. And we can actually see change in that over that period. And another example is the peer navigation program, which has been incorporating peer navigators as support into clinical services to help provide referral into community services and help people guide people across the healthcare system. And we've been using PozQol in that program for over 2 years. And so we will be incorporating, I'll be using the data that Living Positive Victoria has gathered with the PozQol scale in my PhD research, actually, to kind of see if we can measure that, kind of confirm that change in quality of life for participants of that program. So yeah, it's really helped us. And what we hope to show from using PozQol in our services is that you can trust that it's a way to helping meet those challenges for your clients if they if that's something that you learn by using PozQol with them. Thank you so much for having us today. That was really the kind of message that we were hoping to get across, is that to think of quality of life as a way of extending your clinical care outcomes and how you can do that. So thank you so much.
Well, thank you so much to both of you. And it's such a practical tool that, you can say has such a range of application, especially in a lot of different settings, where it can really broaden that conversation beyond, that specific physical health focus, because there's so much more that's also so important. So thank you both for sharing that today.